Hi, this is Rachel Wall, founder of Inspired Hygiene, and I wanted to do this little video for you with a couple slides just to answer a question that we get a lot. Why aren't we adding hygiene days? Why is it that we have for years had a solid, good level of new patient flow, but yet we haven't had a need to add hygiene days? So it's pretty easy for us to conceptually know why that is. Obviously, if that's happening, then it means you're losing more patients every month than you are gaining in new patients. Whether those patients are falling out of recare, which usually is what happens, or there's a status change, right? They go from active to inactive. But let's look at this a little bit deeper. And I will tell you, in the past, it's been not that easy to track. It's doable, but it's not been that easy to track this and to find this information in your practice management system. And so we have started integrating a practice analytics system called Dental Intel. And it's so much easier to see this, and I want to share this with you. So why aren't we adding hygiene days? So one of the metrics that we see in Dental Intel with our clients as we're analyzing their hygiene department is this net patient growth, right? What is the patient growth year over year? And why is it that we have plenty of new patients, but we're not seeing any growth in the hygiene department? We're not having a need to add any hygiene days. And here's what we need to look at. So if you look at this, this diagram here, this is showing a year span of time, right? January the 15th through September 16th. So actually about a year and a half is what this is showing, about 18 months. And what we can see is the blue those are new patients and recaptured patients. So recaptured are patients that you've reactivated that had previously fallen out of recare, for example. And then the red those are all the patients that have either had a specific status change where you have physically changed them from active to inactive, or they have fallen out of activity because it's been 18 months or more since they've been in hygiene, okay? So those are the patients that you're really losing from your practice. And so you can see this practice example, the line is all over the place, right? So the trend is this zigzag line here. And so what you want to make sure in order to have net patient growth is you want this line to always be above zero, okay? You always want it to be above this center line here. Well, many months, this line has been below zero, and some months it's been way below zero. But what do you think happened in this period right here? Okay, what happened was they became aware and they started closing that back door, as we say, right? They looked at, are we just doing random inactivation of patients? Are we even calling patients and trying to recapture or reactivate them? What are we doing? Are we focusing on the new patients that we're getting and really changing our strategy so that we're not getting as many of these shoppers that tend to come, let's say, with a low cost new patient exam, but yet we're finding other ways. Maybe it's an internal marketing policy where we're asking for more referrals and we're getting higher quality new patients. So something happened here to where they started seeing a net gain of patients. So you've got to know where you are with this, and we're always happy to do a no-cost, what they call a snapshot for you with Dental Intel and take a look at this with you and help you interpret this. But I want to show you a couple things that are pretty sobering. This is something else that you can see with Dental Intel is you can see this new patient conversion, right? So part of that net growth also depends on how good are we at getting our new patients to come back. And so Dental Intel did a report, they did a study on about 2,000 practices, and what they saw was this, that the top 10% of practices in the nation, according to those that they studied, were able to convert about 63% of those new patients into another appointment. All right, that's great. The bottom 10% was about 21% of those new patients converted, and the national average was about 42%. I would say based on what we've seen in Inspired Hygiene, this is accurate data. So that's important for you to know, okay? The other thing is hygiene reappoint. So here's the deal. If we don't reappoint these patients for their next hygiene visit, they're essentially inactive the minute they walk out your door. So most practices feel like they're at 90%. They found the top 10 in the nation were at 91% of the patients that are in my hygiene chair today are reappointing today for another hygiene visit. The bottom 10% was 49%, and the national average was 77%. So check this out. If you started with 2,000 patients in recare, okay, and you reappointed 70% of them, which you would think is a pretty strong number, in 6 months, what would happen is you would go from 1,400, you would go from 2,000 to 1,400 patients, right? You would essentially have lost about 600 patients, okay, in recare. Now look at this. If those 1,400 come in, all right, those 1,400 come in and you reappoint 70% of those 1,400 in 6 months, you've now down to 980 patients that are in recare. You've essentially cut your recare pool in half. So that is pretty shocking, but it's something that happens gradually, sometimes without us even noticing. And then all of a sudden we wonder, why are we not as busy as we used to be? And it could be that we're just not paying close attention to the reappoints and how we're converting new patients. So some things to look at in your hygiene department and really pay attention to and track, right? Is your net patient growth every month and your hygiene reappoint or pre-appoint, where you're pre-appointing them for that next hygiene visit before they walk out the door. Always happy to help you with this. Always happy to offer you this no-cost snapshot. Just email us back at clients@inspiredhygiene.com, and we'll happily get you set up with that and help you take a look at it. Thanks so much. See you next time.